I'm delighted to introduce Rachel DeGolia, for the past 15 years, the Executive Director of National UCAN, the Universal Healthcare Action Network, as a Lend Your Voice 2020 UHCAN Ohio Honoree. Rachel moved to Cleveland from Chicago almost 3 decades ago, already a seasoned activist, having run a small nonprofit addressing civil liberties. She joined UCAN just as we were getting it off the ground, as a network of state-based advocacy organizations pushing towards universal health care. To be honest, we were confident we would be successful by the end of the 90s, the 20th century, the second millennium. But we weren't. Despite setbacks in the political dynamics over the past 20 years, Rachel has continued to fight the good fight, with passion and with thoughtfulness. She's an excellent networker because she is well known and respected by a broad mix of key people in advocacy organizations, both small and large. This makes it easier for her to connect kindred spirits from different circles. I know this personally. 2 people she connected with me have become long-term advocacy friends and colleagues. Every month, and when issues are hot, twice a month, she runs a state healthcare leaders midday conference call. On a typical 1-hour call, she gets 7 to 10 speakers, experts in their areas, to talk about their work concisely. And then she wraps it together with sharp contextualization in opening comments and brief remarks between the speakers. For those who can't make the calls, shortly afterwards she posts the audio and then written notes with links. Advocacy leaders from more than 20 states usually participate. A believer in intergenerational advocacy, about 5 years ago, she and I and a case medical student created the Cleveland Healthcare Justice Suppers to develop a community of progressive healthcare professionals and students. Even in these dark, isolated days, the suppers continue, now as virtual suppers, offering food for thought. In 1995, UCAN began using the term healthcare justice, and Rachel persistently emphasizes the language and concepts. So she and I were more than delighted when it was actually the founding med student who named our community building events Healthcare Justice Suppers. Another key aspect of her leadership has been a commitment to creating strategic unity among individuals and organizations who share a commitment to justice but may have different policy preferences or tactical plans. Seeing the long and big picture, she and other members of the UCAN board have consistently encouraged activists to work together, or if they can't work together, respect one another. UCAN Ohio is proud to honor Rachel DeGolia in 2020, the beginning of yet another decade in which the struggle for justice continues. Amen.
I want to thank the board and staff of UCAN Ohio for this great honor and for the wonderful and important work you all do. For the past 20 plus years, I've had the great privilege of running a UCAN's national monthly call for state healthcare justice leaders. We design our calls to provide the big picture of what's happening on issues and campaigns all over the country to help the hardworking, understaffed, under-resourced groups like UCAN Ohio who are on the front lines of the fight for healthcare justice. Since early this year, however, we are all living in an entirely different world created by the coronavirus pandemic. We face millions dying, including unprotected healthcare workers, plus depression-level job loss, frightening new police powers, tens of millions of newly uninsured and people, and magnified inequalities. Much of this devastation stems from our fragmented health and public health systems and our president's self-centered betrayals. We know the suffering of billions of people worldwide is not and will not be shared equally. Compassion, passion, creativity, and the humility to learn from our mistakes is going to be required of all of us as we confront this pandemic. So what we do in the coming weeks and months as health justice activists can make a huge difference. As we protect ourselves, our families, and our communities, we must engage in the political battles that have broken out about why this crisis is so severe and how to respond. We know the severity reflects our current broken economic, healthcare, and political systems. This will come to a head on November 3rd, and then the fight will continue after the election. So based on our assessment that our democracy cannot survive as long as Trump is president, UHCAN's board members have agreed on some key points to guide our work over the coming year, and I'd like to share a few of these with you. First, confronting this pandemic and its aftermath is going to take all of us, a powerful, progressive social movement far broader than we have now. Secondly, we have to take care of ourselves and each other. We're all in this for the long haul. The responses to this public health emergency involve a lot more than public health. And finally, states of emergencies and executive orders are not technicalities, they are political acts. The Trump administration and many governors are using this pandemic as an excuse to attack voting rights, to attack labor rights, access to abortion, and a lot more. So this means that our healthcare justice movement can't just limit ourselves to addressing the health aspects of this crisis. We can't hope someone else is going to take care of voter suppression or the curtailment of civil liberties or the attacks on Asian Americans. We have to join with others to oppose any and all attempts to use the public health crisis to undermine our democracy or attack people. Therefore, National UHCAN is committed to 3 critical priorities this year. First, we must make defending democracy a bigger part of our work now. This means jumping in with democracy defenders to register more voters, create more ways for people to vote remotely, to deal with the multitude of voter suppression measures. And it means securing ballot integrity. Secondly, we must defend and expand our publicly funded health programs and challenge industry profiteering. As we begin to imagine the post-pandemic world, we need to find ways to leverage public support to build a comprehensive, equitable system of healthcare for all. Third, it's on all of us to make sure the healthcare justice movement comes out of 2020 stronger and ready, with deeper connections to other justice movements, ready to move forward in 2021. We can't win on our own, and we can't afford to let our differences, our internal differences, undermine our movement or our common commitment to healthcare justice. So in conclusion, I just want to acknowledge a couple very special people. Dr. Ken Frizoff, our founding chair and longtime board and staff member, together with Diane Lardy, our founding executive director, were pivotal to UHCAN's creation and work for our first 15 years. And I've been fortunate to continue working with them both since then. And I've learned so much from both of them. And I want to thank my husband, Peter DeGolia, with whom I've raised 2 wonderful daughters, who supports me in all the crazy things I do for this work, and who actually himself works in this dysfunctional healthcare system we have, creating and running programs that take care of seniors and are helping pave the way for a more just and effective means of paying for and delivering healthcare. So thank you, UHCAN Ohio, for this great honor, and thank you for being there for all of us.